Every time I see you, you make my heart say.
Hey guys, Ashlee K here, and I'm back with another video once again. I'm sorry if the lighting is kind of gloomy here. I'm filming in front of a big window and it's rainy today, but I'm coming here with a different video. I actually have a scrub top on because I actually want to give you guys this video to kind of be informative. This is going to be a video about being a healthcare aide and experiences of being a healthcare aide, things, tips, tricks, and everything like that. Everything you need to know about being a healthcare aide. So I myself, and actually I'll just give you a background of what I do and everything like that. I myself am a certified healthcare aide. I work with in a rehabilitation center, so I will work with clients that are after surgery, post surgery. Actually doing my nursing. I will be continuing in my nursing career, but I thought as a student it would be best for me to work as a healthcare aide and kind of get the experience and work my way from the bottom and kind of going up all the way to the top, so then I'll know all the different spectrums, all the different ways that I can do care from the bottom as well as working my way all the way up to the top. So I'm just gonna give you guys the pros about being a healthcare aide and kind of the cons, so you can kind of see for your guys' self, see if you wanted to if you are a medical student kind of looking for a job, you don't want to work necessarily retail anymore, or if you are wanting to become a healthcare aide. The pros, the first one that I have is steady pay. So I am a healthcare aide certified in Canada, so I'm only going to speak for that spectrum. I don't know how much the range is for in the States. It ranges from state to state, I would guess. So but me working in Canada, in the province of Alberta, the pay is pretty good. It's steady pay, and I'm a casual as well too. I don't have a rotation or anything like that, so I'm speaking on a casual staff. But basically, it's steady pay. You get a paycheck every bi-weekly, or it could depend on the facility you work at the hospital or at a rehabilitation center or anything like that. So it's bi-weekly, and the pay is pretty good. It's pretty good for a student. A lot of older staff work where I work as well too. So and they've been working there for years and years and years. So the pay is pretty steady as well too. For students, sorry, my phone is ringing. So for a student, speaking on my behalf, I don't pay rent. I live at home. I think it's a very stable paycheck. I'm able to buy the things that I want to buy. I'm able to pay my bills. I'm able to have money for myself. I'm able to go on vacations necessarily, like save a little bit as well too. So it's a very steady pay for a young adult, or if you're an older individual, it's a very steady pay too. If you have a rotation, you get benefits as well too. So you get benefits, healthcare, you get healthcare benefits, you get dental, life insurance, you pay into a pension. So it's a very steady career for if you wanted to have a rotation too. Me being casual, I don't get the opportunity to have benefits. I just work my paycheck and my hours, and that's about it. But basically for what I work and for casuals as well too, you pick up as many shifts as you go. With a rotation, you have a cap as how many shifts you can work, but with casual, you pick up as many shifts as you want to make, as long as you're not working overtime. But sometimes you do have to in some instance, but pretty much it's pretty, you pick up as you go and you get paid as you go. The next point that I want to touch on is experience in the medical field. So being a healthcare aide, it does expose you to working with doctors, nurses, physiotherapists, pharmacists. Like you work with a lot of different people on a day-to-day basis, especially when you're giving care to clients. So you kind of see what doctors do, you kind of see what the nurses do in their scope of practice, you kind of see what you have to do in your scope of practice. So as well as well as you're giving care to the clients, you're also learning and picking up knowledge as you go, because you're kind of seeing how everybody does their job. Like if you want to be a nurse, you're exposed to nurses working side by side with nurses. If you want to be a doctor, like you're exposed to what the doctors do. You see them on a day-to-day basis, so you kind of watch and see how things are conducted on a day-to-day basis, and you're working around these people, so you kind of get experience. So when you do decide to progress in your or further your medical career, you kind of get to see on different spectrums, like how people work and what exactly, if you wanted to work in this facility, what exactly your scope of practice would entail, what you will be doing if you are this person, and things like that. The source is right in front of you to ask. So it's also, it's pretty good to be able to be exposed to these certain things and to actually see exactly where you need to go and what you need to do when you get there. So it's a good pro to have, because you're exposed to everything right there, right in front. That's why, that was one of the main reasons why I wanted to do the healthcare aid, is mainly to just get exposure on exactly what I would have to do when I become a nurse, what are the job entails, things like that, what are the differences working in different facilities, things like that. So that's another pro. And that also leads to connections. So because you're a healthcare aide, you kind of build a rapport with like managers and things like that of a higher standard. So if you wanted to continue your further nursing or further medical education, you can ask your let your manager know that, hey, like, I'm gonna go to school at this point in time, I'm gonna be doing so and so and so, like, can I apply here if possible, or if can I work at this facility if I do continue to work, if I do continue my medical career. And most times, if you are a good worker, they will want to keep you around. So if you move up in your medical profession, they would want you to apply and keep coming back, right? So it's a good thing to have the connections, because then you kind of have like a shoe in after graduation. It's like, okay, I kind of have a job here, I can apply here, you know, connections, my manager know I'm a good worker, things like that. And the last pro that I have is building skills. So it goes in hand with what I said before. When you're working with from the ground up, you get to see everything, you get to work and see all the skills that it will entail from the ground up. So you're not just going in with blindsided, you're kind of seeing like what it is to be a healthcare aide, what it is to be an LPN, what it is to be an RN. Like, you're seeing all the levels as you go up and as you progress. So when you become to the top, it's like you've worked every section. So it's like you should be able to excel because you worked on every level possible and you know what every level entails. So that's kind of what my thinking was going into it. I was like, okay, I might have to do this, you know, it's gonna be a little hard right now, but it's like, you know, it'll pay off in the long run when I actually do want to continue and I actually do make it to the top. It's like I know all the areas of the spectrum. And right now we're gonna get into the cons, honey. Okay, so the cons, the first one that I have is like I said, you're at the lower end of the spectrum. So you kind of have to humble yourself for a little bit and kind of have to just work with it and things like that, and just pretty much go for it full throttle and kind of just work as you go. Even though you're at the lower end of the spectrum, eventually you'll get there and you'll get to where you need to be. So you kind of just have to bend and grit for a little bit. It's not the prettiest of jobs, but it's like you're getting the experience, you're gaining all the knowledge, you're getting all the skills that you need to progress and move forward. So you just have to kind of remember that when you're doing your job, kind of just remember these things, that okay, you know, right now I'm at the bottom, but pretty soon I'm gonna get there, I'm gonna get to where I need to be, and I'm gonna excel and move up. So, and the next, that goes into the next thing that I have, is it is a heavy heavy job. Like, it is not easy, guys. Like, I want to stress that to you. It's not a walk in the park kind of job. Like, it all depends on where you work, but it's like, it's pretty, like, as a healthcare aide, you're doing a lot of the lifting, the pulling, the tugging, the pushing. Like, you're doing a lot of physical work. So I want to stress to you, like, if you guys are not like physically fit or whatever, or you know, like, a lot of people aren't physically fit or don't work out every day. I don't work out every day, but it's like you want to make sure your body is in good standing for this job, because you're doing a lot of lifting, pushing, tugging, like everything physical, you're doing it. So it's like you have to keep that in mind too. Make sure you use good body mechanics when you do go for your training, which I'm also going to talk about certification as well too. So, but make sure you use good body mechanics. Make sure you, when you're positioning and pulling and tugging, you're using the good body postures that you need to be able to do these things, because you can honestly hurt yourself and it can be very detrimental. So I want to stress to you guys, it's not it's not a light career. It's very heavy. So I want to explain that to you guys for sure. So just keep that in mind when you are working. it is a heavy job. And then the next thing is bodily fluids, guys. If you are not okay with bodily fluids, if you are not okay with uh um emesis, if you're not emesis, throwing up, if you're not okay with feces, uh poop, then yeah, this may not be the job for you, honey, because you see it every day, all day. But in the medical field, you see these things all the time. So yeah, if you're not okay with those things, then yeah, you may want to rethink this, because it's the type of job where you're exposed to those things all the time. And nursing, you're exposed to those things all the time. So that's one thing I want to stress to you guys too, is yeah, you're in contact with all type of bodily fluids possible. So make sure you glove up, make sure you everything you got to do, because it's yeah, you're gonna hand in hand too with certification as well too. When I went for my healthcare aid certification, it was about 6 months to do the program. And they basically teach you everything you need to know on like working firsthand with people, things like that, things you will be doing. So they do teach you skills and everything like that on how to deal with these things. So make sure you pay attention and use those skills to, when you actually do work in the fields, revert back to those skills, because those skills will save you. Those are the reasons why a lot of things, a lot of situations that have happened to me, I kind of just found ways to deal with them because of my skills. So make sure you pay attention to your skills and your instructions and how they tell you how to deal with certain situations, because these things are real and they really do happen. So you want to keep that in mind too. So it's like, if you're always upbeat, if you're always smiling, if you're always giving care and things like that, efficient care, and really showing compassion to your clients, that's what really is the key. Like, compassion and really being there, the listening ear when these people need you, is the main thing. So that's mainly the advice, all the advice that I can give you guys doing this job. I've been a healthcare aide for about 2.5 years now. So, and I love my job pretty much. I love working with people. So, and I just can't wait to continue on in my nursing career and everything like that. And I will be keeping you guys updated on how that goes as well too. So I just thought I just wanted to share this with you guys. If this helped anybody at all, just give it a thumbs up. Make sure you guys comment. If you guys have any questions, you can always comment, let me know, or kind of contact me if you can. My email and everything will be down below as well too. If you guys had any questions, personal questions that you don't want to post in comments, that you can ask me, you're more than welcome to as well too. You guys subscribe. Make sure you guys follow me on Instagram, follow me on Snapchat. Everything will be listed down below. All the details that you need will be listed down below, guys. And thank you guys so much for watching, for even clicking this video. Even if you listened, if you took something away from this video, I would greatly love it if you guys let me know in the comments below and everything like that. And I guess I'll see you guys in my next video. Take care.